John Dickerson in our Washington bureau is a CBS News political analyst. John, a recent CBS New York Times poll shows that only 46% of the American public approves of the way the president's handling health care reform. What is he likely to hear from cabinet members about that in this meeting?
What they're going to discuss is how the president can get the message back on health care. He agrees with the public. Everybody agrees that there is something wrong with the current health care system. The problem is the public doesn't agree with the president's cure for that problem.
There's also been criticism that President Obama has left too much of the nitty-gritty of health care reform to Congress. Was that a flawed approach?
Well, the approach was to avoid the mistakes of the Clinton experience in '93 and '94, and the gamble the White House made is if we allow Congress to do its work, that will benefit us in the end when we're trying to put together a piece of legislation. The downside, of course, is that the president loses control of the public message, and what people hear is talk about dollar signs in Congress and not about whether they're going to be able to keep their doctor, keep their health insurance, and that's the message the president is trying to get back to.
How's the president feel he's doing on the economy? I'm sure there is going to be a lot of discussion about that in these meetings.
The White House feels pretty good today about the economy. They got a good number on the gross domestic product. It didn't shrink as much as some people had thought. The president came out and made a statement saying this is because of the Recovery Act. They're very happy to be able to crow a little bit about the success of the Recovery Act.
Having said that, they're being careful not to crow too much.
Absolutely. You talk to White House officials, and they always mention mission accomplished, which was the banner the Bush administration put up with Iraq that turned out not to be the case. They don't want to crow too much. They know people are still out there hurting.
All right. John Dickerson. John, thanks very much.